World Mental Health Day, 10th October 2025. Theme: look at these pictures, logos, World Health Organization, World Federation for Mental Health, and picture shows that emergency care, detail going on. World Mental Health Day is an international day for global mental health education, awareness, and advocacy against social stigma. Here are key points about it. It is observed annually on October 10th. It was first celebrated in 1992 at the initiative of the World Federation for Mental Health with support from World Health Organization and other global partners. Each year a specific theme is chosen by the World Federation for Mental Health to highlight a critical area of mental well-being and a call to action. The official theme for World Mental Health Day on October 10th, 2025 is set by the World Federation for Mental Health and also used by the World Health Organization is access to services, mental health in catastrophes and emergencies. Access to services, mental health in catastrophes and emergencies. Mental health in human emergencies. The theme highlights the critical need for mental health and psychosocial support services to be available and prioritized during and following themes of crisis such as natural disasters, conflicts, and other emergencies. The theme aimed to highlight the critical and often overlooked need to ensure that mental health and psychosocial support is an immediate, integrated, and accessible components of all humanitarian and disaster response efforts worldwide. The goal is to mitigate the psychological impact of crisis and prevent short-term distress from developing to long-term mental health conditions. Ten strategies to achieve this theme. Ten key strategies to ensure mental health services are accessible during catastrophes and emergencies. 1. Mandatory MHPSS integration requires all national and international disaster preparedness plan to allocate budget and resources for MHPSS as a core component of the initial emergency response. To train first responders in PFA, conduct widespread training for non-specialist first-line workers, example police, volunteers, medical staff in psychological first aid PFA to provide immediate human and practical support. 3. Digital telehealth hotlines rapidly establish and publicize free, accessible telephone or online mental health hotlines staffed by trained professionals who can provide immediate support when physical access is difficult. 4. Decentralized community hub. Set up staff culturally appropriate and highly visible support spaces within affected communities. Example in shelters, schools, or community centers rather than relying solely on hospitals. 5. Ensure medication continuity. Develop and implement protocols to maintain an unbroken supply chain of essential psychotropic medications for those with pre-existing conditions. 6. Utilize the layered approach. Adopt the internationally recognized MHPSS pyramid to provide tiered services from basic safety and social support to non-specialized clinical care and finally specialized mental health treatment. 7. Empower peer support networks, mobilize and train survivors and community leaders to facilitate peer-to-peer and self-help groups, leveraging local resources and knowledge for mutual support. 8. Protect responder well-being, establish mandatory mental health and burnout prevention programs including counseling and rest periods for humanitarian workers and disaster relief teams. 9. Clear anti-stigma messaging. Launch public campaign that normalize psychological distress during crisis and encourage help seeking, making it clear that trauma is a common human reaction. 10. Build back better system. Advocate for post emergency funding to be used not just to restore but to sustainably strengthen and integrate long term mental health services into general primary health care system. Thank you. Have a happy World Mental Health Day.